Okay guys, so for this video we're going to be talking about cardiac output. Now cardiac output's units is liters per minute. Now this makes sense if you think about that stroke volume is the amount of volume being released from the heart, and that's going to be measured in liters, and you're going to have heart rate, which is going to be the time component. Now if you go here and look at what the definition of cardiac output is, it is really the amount of blood ejected per minute. We should also know that cardiac output increases or decreases due to the demands of the body, such as during exercise or with stress. The second thing is that there's an increase in cardiac output will therefore cause an increase in work and an increase in oxygen consumption as a result. Lastly, the changes that occur with cardiac output are often seen during pathologies or during adaptive responses such as exercise, as I previously mentioned. Now, cardiac output is determined by 4 different variables that we can break down and really grasp right now. So the first thing we're going to look at is preload. Now if you think about the word preload, we see the word pre, which means before, and load referring to volume. So we can now think that, okay, preload is before the contraction, it is the volume that is inside the left ventricle. Now if we know that there's an increase in blood in the left ventricle, that means that there has to be an increase in stretching within the ventricle as well, and therefore an increase in blood output. This is explained by the Starling curve, which I will cover in a future video. Now the preload is determined on 3 basic variables. It's going to be determined by the volume, as an increase or decrease, obviously, of blood will cause an increase in the total volume within the left ventricle. It is determined by a decrease or increase in heart rate. Now a decrease in heart rate will cause an increase in preload because there's less time of the heart pumping, therefore there's going to be more time for the heart to fill with blood. And lastly, the veins. So when you're constricting the veins act as a storage pool of blood, and therefore when you constrict them, the blood has no place to go but to shoot up towards the heart, therefore causing an increase in preload of the heart. The next thing we're going to be talking about is contractility. Contractility is the force of squeezing the heart, so it's how hard the heart is really squeezing. Therefore, what's really controlling this squeezing and pushing the blood out is actually the sympathetic nervous system, because the SNS is what's going to actually innervate the heart using beta-1 receptors. So these, and also the SNS causes a release of epinephrine and norepinephrine, which will cause further increase in the contractility of the heart. And contractility is manipulated during exercise, stress, and different drugs. Now the next variable we're going to be looking at is the afterload. Now the afterload also we can think about similar to the preload, except now we're talking about how much volume is in the left ventricle after the contraction. So if we can really think about how, if there's an increase in blood in the left ventricle, that must mean there has to be an increase in resistance out of the left ventricle, which can be caused due to the blood vessels or through the organs. So using these 2 concepts, you can really think about how the heart pressure has to overcome a certain amount of resistance in order to push blood out of the heart. Therefore, when this pressure is not sufficient enough to overcome this resistance, we're going to be seeing this increase in blood in the left ventricle. So what exactly is the afterload dependent on? Well, it's going to be dependent on the blood pressure. So the way I like to think about this, it's like a traffic jam. The more, if you think about blood as the equivalent to cars, the more cars that you have inside the jam, it's going to be harder to leave that road. And the second thing that's going to be occurring is the obstruction. Whereas the way I think about it as well is if you have a lane going from 3 or 4 lanes into a single lane, that means it's going to be much harder to pass through because there's more cars trying to go through that one area due to an obstruction. So that's the way I like to think about afterload, and it pretty much all comes down to the amount of resistance of blood leaving the heart. The last variable we're going to be talking about is the heart rate. Now the heart rate actually works with contractility directly during the physiological state. There are studies that show in labs and such that just talk about heart rate itself, but in this situation we're going to be talking about heart rate with the cardiac output, as that's what we're going to see physiologically. Now the heart rate increases with stroke volume up to a maximum point. So what exactly does that mean? So you can see the cardiac output increasing as the heart rate increases up to a certain point. So what occurs at this point is that the heart rate is way too high. So therefore, the heart does not have enough time to fill up with blood. So therefore, you're going to have a decrease in volume as a result. So you can see that the filling time plays a crucial role in this as well. So that is the conclusion of this video, and please like, comment, and subscribe. Thank you very much, and good luck studying.